Hi, I'm Kyle. I'm an electronic medical records assistant here at the Volunteer Healthcare Clinic. VHC is a volunteer driven clinic that has been in operation in Central Austin since 1966.
In 2019, we had 491 volunteers, 14,636 volunteer hours, 4,500 medical visits, and 5,724 prescriptions. In 2020, we realized in order to continue to serve our patients, we had to expand the telehealth visits, which was all new to us.
Hi, my name is Sylvia Reyes, and I'm the program director here at the Volunteer Healthcare Clinic. In early April, the clinic made the difficult decision to close its in-person visits due to COVID-19. However, we remained open, providing refills and curbside pickups for patients of the clinic. Once May came around, we were unsure how long this pandemic was truly going to last, so we decided to start exploring telehealth services. So telehealth was really completely new to us. We really wanted to understand from our patients after our initial pilot how they were feeling with the quality of the services, and then also we wanted to know if there was anything that we could do to make the services better. At that same time, we knew that there was needs that the patients were having. So they were having a lot of food insecurity, there was a lot of job losses. And so we wanted to create a survey where we were going to solicit feedback, but also ask our patients what their needs were. Towards the end of the telehealth pilot, we knew we wanted to do this. We really didn't have anyone to do this. But luckily, it was around June. We got a Vista associate to help us over the summer. They created the survey on paper, both in English and in Spanish. And by the end of June, we were already starting to solicit that feedback from our patients. So once we started to collect the surveys, we knew that we really wanted to take that information and collect that data somewhere. Through the Quality Collaborative, which is run by the Texas Association of Charitable Clinics, and that is funded by the St. David's Foundation, we were able to get in touch with a program called Rounds. And so they took our survey and put it into a digital platform, and now we have the ability to put in our responses on the software and get some really beautiful graphs that really are just an even better way to look at the data and to use that data to inform our programs and services.
My name is Priya, and I'm one of the volunteers that helped conduct the survey this summer. So for the clinic, the survey was really important in evaluating the telemedicine appointments that we had. Something that we found is that 84.3% of our clients had access to a phone with Wi-Fi and a front-facing camera. So for us, this really opened up the possibility of having more video appointments. In addition to that, the qualitative feedback from the survey showed that our patients still felt listened to and respected. And a really interesting statistic is that of the 17% of patients that had both a video and phone call, we found that 13.3% actually preferred having the phone call. As Renee and Sylvia mentioned, another really important part of the survey was using it to understand the social determinants of health and our clients' non-healthcare related needs. So for us, one of the things we found is that 36.9% of our respondees to the survey stated that they had some form of problem of getting access to food. So when we were making these initial phone calls for the survey, we actually used that as targeted marketing for a food drive that we were hosting. It was through generous partnership and generous donations from the Sci Center of Austin that we were able to serve over 50 of our patients and their family members. One of the last really important findings from our survey was that many of our patients expressed a desire to know more information about some of their healthcare conditions. What type of nutrition advice, what types of exercise they should be doing, how to use a blood pressure cuff, how to use a blood glucometer. For us, we were able to take these specific requests and then connect our patients with our nurses and our pharmacists.
So as a pharmacist that volunteers here occasionally, I've noticed that the engagement of the patients is profound. They just seem more involved and more interested, and I think it's because when we start these conversations with them, that's targeted towards their interests and what they're trying to learn. And that opens the door to providing them more information that I may deem as a clinician important for them, and maybe things that they hadn't thought of. But it helps establish that rapport and establish that engagement and really opens the door.
This volunteer pharmacist's experience is indicative of how data is informing patient care and allows us to serve our clients better. Although I'm sure right now, like us, you don't feel like you have the time, staff, equipment, or even capacity to start a new project, I encourage you to seek out support, and through collaboration and effort, I know you can do this successfully. You are already doing the work, actively meeting your clients' and patients' needs. This just allows you to put structure around the work, and it allows you to target patient care, and it provides you with information that helps you clearly share your progress with stakeholders and funders.
The biggest takeaway or just thought that I have when it comes to getting something new started. I mean, we started telehealth. It was brand new to us. We wanted to solicit feedback. We really didn't have the help, but turns out we ended up having some help over the summer, and they were able to take this on as a project. And through some of our collaborations, we were able to get some really cool software. So just get things started, just try. I know it's a hard time for everyone. We're all having to adjust the way that we're doing things, but just use the information that you can gather to really help make things better. I know it's really, really difficult, but it can be done, and I'm sure you can do it too.